This is Paula Kaler, and I am going to speak for Ms. Garvel's class. Okay. If you have ever been to a hospital as a patient or as a loved one, it can be scary and stressful. The many medical equipment scattered around and the procedures that you're having to go through, it can all be so overwhelming. And on top of that, you have all these doctors and nurses saying all these complicated words and you don't know what any of it means. This can cause anxiety and nervousness, and it can make your stay at the hospital less welcoming than you need it to be. Today I will be speaking about how to effectively communicate within a hospital setting. For the most part, the people in the audience will never likely be in as a medical professional. So it might not make more sense to you as why I would be giving the speech, but it could help you more of the patient side of things to understand what doctors and nurses have to go through to effectively communicate with patients. After struggling with patients' anxiety over not understanding what's going on around them, I wanted to know more about how I could effectively communicate with people. So I started to research. I will explain how to avoid medical jargon, use modern language, how not to rush my words when I speak to patients, and to use the 4 R's of patient preferences to better communicate with patients. The first one I'll be talking about is how to avoid medical jargon when addressing patients. According to the March 2015 article, A Guide to Communicating with Children in Healthcare by Linda Lambert, who is an experienced RN of 3 years, she says that the best way to effectively communicate is to avoid medical jargon, which is big medical words, or medical terminology. She says for very young children, you have to use words that are as simple as possible, meaning medical jargon is a no-go. Saying words like colonoscopy, appendectomy is not going to mean much to a little 6-year-old. You have to say words like, we're going to do some remodeling inside of you so you can feel better, stuff like that, so they don't feel anxious and they understand what's kind of going on with them. According to an April 2016 article called Talking with Older Patients by the National Institute of Aging, they explain how avoiding medical jargon in the older patients would be optimal. They say, try not to assume that patients know medical terminology or a lot about their disease. Most of older patients really have dementia when they're in the hospital, so they're not going to necessarily remember that what their disease is, what they're going through. So like saying, I know you've had this for so long, that's not going to mean anything to them when they're not comprehensive. Just as important as avoiding medical jargon, you want to be sure to avoid modern language when talking to patients. According to that same article, A Guide to Communicating with Children in Healthcare by Linda Lambert, she says that using modern language can really help a patient out. She says you need to use modern language to get down on the level of the child and use a soft tone. Not only will this work with children, but if you do have older patients, that will also work with them. Using a soft tone and just using language that they would understand. In addition to using modern language and avoiding medical jargon, you want to avoid rushing your words. In the long run of patient care, not rushing words would help. According to the 2016 article, Talking with Your Older Patient by the National Institute of Aging, they state older people may have trouble following rapid firing of questions or torrents of info. So by speaking more slowly, give time to process what is being asked and said. They're not going to understand many questions at once. They're not going to understand big words. They're not going to understand much of anything if all you're doing is rushing your words. So by slowing down and saying everything with an articulation, patients will be more willing to listen and less anxious after the scheme of things. In addition to the previous points, the 4 R's of patient preference will help communication better. According to the December 2013 article, for the 4 R's of respecting patient preferences, the 4 R's of the article are reach out, record, retrieve, and respect. When you reach out, you want to ask goals and preferences for their care, including voice if they can't speak. When you want to record and chart to make sure that all of the patient care team knows that this is what the patient wants and that they believe a certain way. Retrieve, you want to ensure that the preference promptly avoids any predictive future. So if you have a patient and they're regular in the hospital, you want to keep that so that you don't have to ask them every time, because I'm sure that gets annoying. And then respect, you want to ensure that the patient's preferences are respected at all times. This will help with communication, because if you know what the patient prefers, then you're more likely to have communication better. If you respect them, they're more likely to be more willing to come and speak to you about things. Today I discussed how to avoid medical jargon, use modern language, and not rush words, along with the 4 R's to better patient care. If you ever go to a hospital now, which I hope you don't, you know how to ask your doctor to better care for you, better communicate with you, because you have these points. Effective communication with patients can help with care. Healthcare professionals get through hard shifts, because if somebody is not comfortable in their surroundings and they don't feel like the healthcare team is taking care of them how they need to be, and they can't communicate with that, it's going to make for a longer shift for the patient and for the healthcare professional. These learned skills can help you in anywhere in your life, really, but this is for the hospital setting. And that is it.
Good job.